Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the fifth anatomy lecture of the RESP block. This lecture needs a little bit of concentration and imagination, so please pay attention. Now, Bismillah, let's start. First of all, we need to know that this lecture is going to talk about the larynx. So we're going to talk about everything to do with the larynx. The anatomical structure, the muscles, the nerve supply, كل شيء له علاقة بالlarynx, okay? So, starting off with the structure or the anatomical structure of the larynx. The larynx is made of cartilage, okay? It's made of purely cartilage. The cartilage هذولي, it's not just one, it's a couple of cartilages or a bunch of cartilages. أكثر من واحدة يعني. So these cartilages have spaces between them. The spaces are filled with with membrane. بعدين they're covered with muscles. But then everything is lined or covered by a mucous membrane or a mucosal lining. Okay, this is just an overview of the whole structure. Now we're gonna see each part in details. Okay, but before we see each part in details, if you remember from the last lecture when we were talking about the pharynx, we need to mention the vertebral level of the larynx. So what's the vertebral level of the larynx? If you remember here, when we mentioned the laryngopharynx, we said the laryngopharynx is C4 to C6, C4, 5 and 6. تمام? So the vertebral level of the larynx is cervical vertebra 4 و 5 و 6. تمام? Now let's see the structure, the anterior view and the posterior view. Here we have the lateral view, but let's focus on the anterior posterior views first. So over here we have here a hyoid bone. You know the hyoid bone, صح? So the hyoid bone is the hanging bone. We're gonna forget about it. The doctor didn't say anything about it and we're not gonna mention anything about it, so imagine it's not there, just forget it. تمام? We're gonna talk about the cartilages. أول شيء we have to divide the cartilage into two groups, single cartilages and paired cartilages. The single are 3 and the paired are 3 as well. But we're gonna focus on the single, okay? The single عندنا thyroid و cricoid و epiglottis. والpaired عندنا arytenoid و corniculate and cuneiform. تمام? Now let's start with the single. The single cartilages عندنا, we said the largest cartilage is known as the thyroid cartilage. But then right under it we have the cricoid cartilage, which is the last part of the larynx. And then on the very top we have the epiglottis, but we can't see it on the anterior view very clearly. We can see it when في posterior view. So here we can see the epiglottis. تمام? كده we're done with the 3 single cartilages. Now let's see the paired cartilage. The paired cartilages عندنا, we said the first one is known as the arytenoid cartilage, which is this big one. The 2 pairs, they're known as arytenoid cartilage. Right above them we have the cuneiform cartilages. But then this little one on the very top is known as the corniculate cartilages. تمام? Now let's talk about each cartilage in details and see everything about it. First of all, we're going to start with the largest cartilage known as the thyroid cartilage. The thyroid cartilage looks like an open book, okay? So شكلها زي الكتاب, كأنه فاتحين كتاب. The open book has 2 covers, صح? Any book has a cover, like two covers, like the on front and on the back. So الcovers حقت الكتاب هذه, or these 2 covers of the book of the thyroid cartilage are known as lamina. So we have 2 laminas, تمام? We have 2 laminas. The 2 laminas meet in the middle. What's this part in the middle called? We're going to call it laryngeal prominence. Laryngeal prominence. We can also say it here. So the laryngeal prominence is also known as Adam's apple or تفاحة Adam. So what forms تفاحة Adam, or what forms the part where we call Adam's apple? It's the meeting point of the 2 laminas, which is also known as the laryngeal prominence. Okay? But then عندنا this notch known as the superior thyroid notch. Okay? This is the anterior view, both of them, and then here this is the superior view, and now we're gonna see the posterior view. The posterior view, we have an important part. We have أول شيء here the upper extension. We're not gonna know anything about them, they're just there يعني. And then we have the downward extensions are very important. Why are they very important? لأنه they form a synovial joint with the cricoid cartilage. The cricoid cartilage قلنا هنا is the cartilage right underneath the thyroid. So here they form a joint together. We're gonna see this joint, okay? This is the synovial joint formed by who? Formed by the downward extension of the thyroid cartilage with the cricoid cartilage. Which movement does this joint allow? It allows the anterior posterior movement of the larynx. So the anterior posterior movement of the larynx is formed by the synovial joint between the downward extension of the thyroid cartilage and the cricoid cartilage. Okay, now let's see the cricoid cartilage. The cricoid cartilage is the last part of the larynx. Okay, we said the vertebral level for larynx is C4, 5, and 6, right? So since the cricoid cartilage is the last part, it's gonna be at level C6. So cricoid cartilage is at C6. Okay, how does it look like? It looks like a ring. It's the only completely closed cartilage. Yani it's closed from all sides. It's basically a ring. Okay, so the cricoid cartilage is a ring, or it's a ring-shaped cartilage. Okay, and it's the only closed or completely closed cartilage. Okay, the anterior part here of the cricoid cartilage, this is the anterior side, لأنه هنا we have the thyroid cartilage, so this is the anterior part. The anterior part of the cricoid cartilage is known as the anterior narrow arch. The anterior narrow arch, لأنه it's very thin and narrow. Okay, the posterior part is known as the posterior quadriminal lamina. Posterior quadriminal lamina, لأنه it's very thick and big, and most importantly it has the articulation surfaces of the joints. Okay, so we said the first joint is between mean and mean. It's between the thyroid, the downward extension of the thyroid cartilage مع الcricoid cartilage. We have a second joint. The second joint is between who? It's between the cricoid cartilage with the arytenoid cartilage. Remember the arytenoid? The arytenoid is one of the paired cartilages here, we said. Okay, so the arytenoid has a joint with the cricoid هنا, you can see. طيب, this is the second joint between the cricoid and some other cartilage. Which movement does this joint allow? It allows the rotatory movement or rotation. It allows rotation of the larynx. So قلنا the first joint, which was between the thyroid, the downward extension of the thyroid مع الcricoid, it allows which movement? It allows anterior posterior movement of the larynx. أما this joint between the arytenoid cartilage والcricoid, it allows rotatory movement or rotation of the larynx. Okay, now let's move to the third single cartilage, which is the epiglottis. The epiglottis, the doctor didn't mention a lot of stuff about it, ولكن we need to know that it's the most superior cartilage. Okay, it's the most superior cartilage. حتى here when we look from the anterior view, we can see it. It's the first thing we can see, right? From the posterior view, it's also the first thing we can see. So it's the most superior cartilage في larynx. Okay, it has two surfaces. It has a posterior surface known as posterior laryngeal and anterior lingual surface. Okay, so posterior laryngeal surface and anterior lingual surface. Okay, it's a leaf-like shaped elastic cartilage. It lies behind the tongue. Okay, as we can see here, this is the tongue here. It lies behind the tongue. Okay, and it has the superior part is known as the free rounded border of the epiglottis, and then the last part or the inferior part is known as the tapering end. Okay, because it's a sharp end, so it's known as the tapering end. The tapering end is attached when it's attached to the thyroid cartilage, the inner surface of the thyroid cartilage. So this is the thyroid هنا, it's attached to the inner surface حق the thyroid. Okay, so now we're done with the 3 single cartilages. Let's move to the 3 paired cartilages. Okay, the 3 paired cartilages, the first one we have is known as the arytenoid cartilage. So the arytenoid cartilage is a pyramid shaped cartilage. It looks like a pyramid, like ahramat. Okay, and the base of the pyramid, this is the pyramid كده, the base of it has 2 processes. Okay, we have an anterior process and a posterior process. Okay, so the anterior process of the arytenoid cartilage is known as the vocal process. Why is it known as the vocal process? Because it has the attachment for the vocal cords. أما the posterior process is known as the muscular process. Why? Because it has the attachment of the muscles controlling the vocal cords. Basically the arytenoid cartilage is related to the vocal cords. Any attachment for the vocal cords or anything related to the vocal cords, it's gonna be where? It's gonna be in the arytenoid cartilage. تمام? Now let's move to the next 2 paired cartilages, which are the cuneiform and the corniculate. But these 2 cartilages are not very important. We don't have to know anything about them other than that both of them, they lie in the epiglottic fold. What is the epiglottic fold? We're gonna see it now. Okay, Now كده we're done with the cartilages, everything to do with the cartilages. Let's move to the second part, which are the ligaments and membranes. So the ligaments and membranes are gonna be named after any two articulation, يعني it's gonna be named after the two cartilages it's between, or the cartilage and the bone it's between. So remember the hyoid bone I told you to forget about? Just remember it for the next slide بس, and then you can forget it again. But we just need it for the naming, okay? So we're gonna use the hyoid bone for naming the ligaments and membranes, تمام? So we said the membrane is gonna be anything between two surfaces, يعني two cartilages, a bone and a cartilage whatsoever, تمام? So here we have, for example, the thyrohyoid membrane. Thyrohyoid من اسمها هتكون between the thyroid cartilage and the hyoid bone. So we're always gonna start the naming from the lower one. يعني for example, if the thyroid is lower than the hyoid, صح? So that's why the name starts with thyrohyoid, okay? So thyrohyoid membrane is this membrane here in the middle between the two of them, okay? What do we need to know about the thyrohyoid? We said it's between the thyroid cartilage and the hyoid bone. It shows a median thick part. What do we call it? Median thyrohyoid ligament, تمام? يعني any thicker part, يعني the membrane is like الغشاء. So the membrane is very thin, okay? What's thicker than the membrane? The ligament. So we're just gonna take the same name ونضيف عليها median. So median thyrohyoid ligament is the thicker part of the thyrohyoid membrane, تمام? And the most important part here, which is we have two structures that pierce the thyrohyoid membrane. What are they? The first one is the internal laryngeal nerve and the superior laryngeal artery. So we have a nerve and an artery that are piercing the thyrohyoid membrane. The nerve is internal laryngeal nerve. Internal laryngeal nerve pierces through the thyrohyoid membrane. And superior laryngeal artery. Superior laryngeal artery. So, I tried figuring out a way to memorize this, but I couldn't figure any way other than memorizing them. So, if you have a way, you can help us all out. But for now, just remember, we have an artery and nerve that pierce the thyrohyoid membrane. The artery is superior laryngeal artery, and the nerve is internal laryngeal nerve. Okay. Now let's move to. Let's skip these two ligaments. We're gonna come back to them. We're gonna move to the next membrane known as the quadrate membrane. The quadrate membrane is the biggest membrane, okay? Almost the biggest one that has a lot of borders and surfaces, okay? So let's see it. Here, the one in green, this is the quadrate membrane. It's a square-shaped membrane between ايش and ايش. It's between the arytenoid cartilage and the epiglottis. So it's between the arytenoid cartilage and the epiglottis. The arytenoid is going to be posteriorly هنا, and the epiglottis is going to be anteriorly, okay? And here it's square shaped, as we can see, okay? So now let's see the borders حقت الquadrate membrane. What are the borders? We have anteriorly هنا the epiglottis, okay? Posteriorly we have the arytenoid cartilage. What do we have laterally? خلاص, laterally يعني here up, okay? So here up and down we have two borders. The upper border known as the superior free border, because it's free, يعني it's not connected to anything, so we call it the superior free border. The superior free border has what's known as the epiglottic fold. What is the epiglottic fold? The epiglottic fold was previously an epiglottic ligament. But what happened to it after the epiglottic ligament got covered or lined by a mucous membrane or a mucosal membrane, اتغير اسمها, its name changed into a fold. So once a ligament is covered by a mucosal membrane or by a mucous membrane, we change its name to a fold, okay? So the epiglottic fold was previously an epiglottic ligament, okay? Which is this part. طبعا this structure is on both sides because we have two sides. So قلنا we have the superior free border, it has the epiglottic fold. Then the inferior free border. What does the inferior free border have? It has a vestibular fold. Vestibular fold. So the vestibular fold is the lower free border of the quadrate membrane. تمام؟ كده we know the boundaries of the quadrate membrane. قلنا خلاص the anteriorly it's the epiglottis, posteriorly it's the arytenoid, the superior free border is the epiglottic fold, and the inferior free border is the vestibular fold. Okay, now we're gonna see the next membrane. The next membrane is the cricothyroid membrane. So the cricothyroid membrane from its name, it's between ايش؟ It's between the cricoid and the thyroid. تمام? So we can see it here. This is the cricothyroid membrane, which is the dark green one. Okay, here this is the cricoid and this is the thyroid. تمام? So we're gonna see برضو the borders or the boundaries of the cricothyroid membrane. The boundaries of the cricothyroid membrane, we have anteriorly the thyroid, okay, posteriorly the anterior vocal process. Remember قلنا the arytenoid is like a pyramid, right? And we have two processes, anteriorly and posteriorly. صح? We said this is the anterior process and this is the posterior process. So the posterior boundary of the cricothyroid membrane is what is the anterior vocal process. تمام? The anterior vocal process of the arytenoid is or forms the posterior border of the cricothyroidal membrane. تمام? Now we have superiorly, okay, the superior border or the upper free border. As you can see, there's a space here. The upper free border is formed by vocal ligament. It's formed by the vocal ligament. تمام؟ تمام. The last membrane we have is the coриcotracheal membrane. Okay, the coриcotracheal membrane from its name, it's between ايش and ايش? It's between the cricoid cartilage and the trachea. So as we know, the cricoid cartilage is the last part of the larynx. Okay, so right underneath it we're gonna have the trachea. Okay, in between the cricoid cartilage, which is the last part of the larynx, and the trachea, we have a membrane known as the coриcotracheal membrane. Okay, that's all we need to know about it. Now let's go back to the two ligaments here we skipped. Okay, these two ligaments are very small ligaments. It's known as the hyoepiglottic ligament. So it's between the hyoid bone and the epiglottic or the epiglottis. تمام? So it's between the hyoid bone and the epiglottis. Okay, so this is the first ligament known as hyoepiglottic ligament. The second ligament is known as thyroepiglottic ligament. It's between the thyroid cartilage and the epiglottis. So it's called thyroepiglottic ligament. Okay, that's all we need to know about them. Now let's move to an important part. Now we talked about this whole structure of the larynx and what the membranes are and what the ligaments are and what the cartilages are and what's between them and everything, صح? So this is all known as the laryngeal cavity. Okay, so this cavity we're gonna divide it into 3 sections. Okay, so let's see it here. This is the laryngeal cavity or the larynx, right? So we're gonna divide the first section is gonna be from the top all the way till here, which is the vestibular fold. From the top all the way to the vestibular fold, we're gonna call this part ايش؟ the vestibule. The vestibule. So this is the vestibule of the laryngeal cavity. Then starting from the vestibular fold till the vocal fold, اللي هي the small tiny part in the middle, is known as sinus. We're gonna call it ايش؟ sinus. So this is the sinus of the laryngeal cavity. And then the last part is between ايش؟ the vocal cords all the way to the cricoid. This is gonna be the infraglottic. The infraglottic. Okay? So here we have the divisions: vestibule, okay, and then the sinus, and then the infraglottic cavity. In the vestibule, we have a very important structure known as the laryngeal inlet. Remember when we were studying about the thoracic cavity, we said we have a thoracic inlet and thoracic outlet, صح? So here we have something similar known as the laryngeal inlet. So we're gonna see the borders that form the laryngeal inlet. So what forms the laryngeal inlet? Anteriorly, it's formed by the epiglottis. Here we can see anteriorly, it's formed by the epiglottis. Posteriorly, it's formed by the arytenoid cartilages. Posterior, the arytenoid cartilage. And then laterally or on the sides, we have the epiglottic folds. Okay, the epiglottic folds, what did we say they were made of, or what's the origin of the epiglottic folds? The origin of the epiglottic folds are the upper border of the quadrate membrane. So remember, this is the quadrate membrane, and this is the upper border for it. So it's known as ايش؟ the epiglottic fold. تمام? So these are the borders for the laryngeal inlet. Okay? We have to remember these divisions, and where does it start and where does it end and all. Okay? So the vestibule قلنا from the top all the way till the vestibular fold. So remember, vestibular fold. Vestibule ends at the vestibular fold. But then the sinus is a very small part between V and V. So sinus is between V and V. Sinus is between vestibular fold and vocal fold. So V and V, between them we have the sinus. This area is going to be called as the sinus. But then the last part is between the vocal cords all the way to the cricoid, which is the last part of the larynx. We're going to call it infraglottic. Okay? One more thing we have is the rhima vestibules and rhima glottides, or vestibuli and rhima glottides. Okay? Rhima means distance. Okay? So distance between the two vestibules, and distance between glottides is the vocal folds. Okay? So the distance between the vocal folds and the distance between the vestibules. Here, this is another diagram that shows us the divisions of the laryngeal cavity. So قلنا the first part of the laryngeal cavity from the top all the way to the vestibular fold is gonna be known as the vestibule. Okay, so this is the vestibule. And then here in the the middle we have the sinus. Okay, it's between the vestibule or the vestibular fold and the vocal fold. And then the last thing here we have the infraglottic. Okay? هنا the one in blue is the rhima vestibules. Why? لأنه it's connecting it's the distance between the two vestibules. Okay, this is not an actual line or anything. No, this is just an arch to show us where the rhima vestibule is. So this area between the two vestibular folds or the two vestibules is known as rhima vestibuli. Okay, so this is the rhima vestibuli. Okay, هنا these are the two vestibular folds. هنا هذه الاريا اللي في النص اسمها كده. The second area we have is between the two vocal folds. These are the two vocal folds. هنا عندنا واحدة وهنا عندنا واحدة. So this area in the middle is known as rhima glottides. Okay? Okay. So here we have a video that shows us how the vocal folds move. Okay? So let's see it. The vocal folds are the ones in white. Okay? So you can see how they move when the person speaks or talks. So the vocal folds are moving they're adducting and abducting. They're moving closer to each other and opening. So they're opening and closing the airway, right? So if you can pay attention and see, you can see in between, you can see the C-shaped cartilages, which are the trachea, or which make up the trachea. Okay? Now let's go back to the lecture and see how or what allows this movement, okay, of the vocal folds. Okay? Obviously they need muscles, right? So we're gonna see the muscles of the larynx. Okay, before we move to the muscles, let's see two important points about the vocal folds. The first thing we need to know about the vocal folds is they're made of the upper border of the coracothyroid membrane. Remember the coracothyroid membrane we mentioned here above? So this is the coracothyroid membrane. So the upper border of it is or makes up the vocal folds. تمام? The second thing is they're attached between the thyroid and arytenoid cartilages, right? Because here, if we go back again, they're attached between the thyroid and arytenoid cartilage. And the last thing we need to know about them is that they are avascular. Avascular يعني they have no blood vessels or no supply. يعني they have no blood vessels or no any arteries or veins going through them. Okay, so that's why they show under the laryngoscope, when we insert the laryngoscope, they're viewed as white. They look white, okay? Because they have no blood supply, because they are avascular, okay? Now let's move to the muscles of the larynx. The muscles of the larynx are divided into two parts or two sections. The first part are the extrinsic muscles, and the other part is the intrinsic muscles. Extrinsic muscles means they move the larynx, كل laryngeal cavity, up and down. okay, they elevate and depress the larynx or the laryngeal cavity, okay, the whole larynx كلها كذا على بعضها, it moves it, the extrinsic muscles move the laryngeal cavity up and down, okay. The intrinsic muscles move the joints of the larynx, يعني they don't move the whole larynx, they just move the joints and specific areas are moved by the intrinsic muscles, okay. The extrinsics are really easy. There are two. عندنا suprahyoid and infrahyoid. Suprahyoid above the hyoid bone وinfrahyoid below the hyoid bone. So السوبراهايويد خلاص لأنها up, it's superior, it's up, it elevates the larynx, ترفعها على فوق, it elevates the larynx. أما الانفراهايويد it's down or underneath, so it depresses the larynx. Okay, كده we're done with the extrinsic. Now let's move to the intrinsic. For the intrinsic we have the divisions of the intrinsic are three. يعني under the intrinsic we have three types of intrinsic muscles. The first type, what do? They open and close the laryngeal inlet. So remember the laryngeal inlet, what opens it and closes it, or what which muscles change the size of the laryngeal inlet? These three muscles, okay. So the first one we have is the thyroepiglottic. So thyroepiglottic from its name is between the thyroid and the epiglottis, right? So the thyroepiglottic is the only one that widens the laryngeal inlet. It widens it, طيب فبتوسع laryngeal inlet. The other two, which are the aryepiglottic, which is between the arytenoid and the epiglottis, and the intra-arytenoid, which is between the two arytenoid cartilages, okay? So these two are in charge of closing the laryngeal inlet. So they close the laryngeal inlet, طيب. The only one that widens or opens the laryngeal inlet is the thyroepiglottic, okay? Now we're done with the first section of the intrinsic muscles. Let's go to the second part. The second part of the intrinsic muscles are the muscles that are in charge of the vocal cords, okay? So what do they do to the vocal cords? They either adduct it or abduct it. Did you see remember as we said in the video, we saw them that they're adducting and abducting. They're moving closer to each other and far apart. So what are the muscles that are in charge of this action? There are two muscles. The first one is known as the posterior cricoarytenoid or the posterior cricoarytenoid muscle, okay? This is in charge of abducting the vocal cords. Abducting يعني moving them apart, okay? So it's in charge of abducting the vocal cords. Wait, let's see them here so it's clear. Yes, here. So this is the posterior cricoarytenoids. They're in charge of abducting the vocal cords, the vocal folds. That means ايش بيعملوا? They open the vocal folds, or they open the space. So they're also known as muscles of life. لأنه if they're closed forever, يعني if these muscles are not working, the folds are going to be closed, right? They're going to be like this. So no air is going to pass, so the person is not going to be able to breathe. So that's why they're known as the muscles of life, تمام? The other ones اللي هم they do the opposite action, the opposing action, are the lateral cricoarytenoid. The lateral close them, okay? They adduct the vocal folds. So the lateral adduct the vocal folds, while the posterior cricoarytenoids, they abduct the vocal cords, okay? Now let's go to the last section of the muscles, of the intrinsic muscles, which what do? They either relax or tense the vocal cords. So tense يعني يخلوهم مشدودين, relax يعني relax, okay? So there's only one muscle that's in charge of tensing the vocal cords, which is the cricothyroid muscle. The cricothyroid muscle is very important. We need to remember it because it has an exception, okay? So the cricothyroid muscle is the only muscle in charge of tensing the vocal cords, or the tension, تزيد التنشن في الvocal cords, تمام? It's the only muscle. It's known as cricothyroid muscle, okay? It causes the high pitch sound. When someone has a high pitch sound يعني كده يكون الصوت سنين أو يعني قوي يعني, this is because of the cricothyroid muscle, okay? The other two muscles, they're in charge of relaxing the vocal cords, يخلوهم relax, which are vocalis and thyroarytenoid, okay? So the vocalis with thyroarytenoid are in charge of relaxing the vocal cords, while the cricothyroid is in charge of the tension or tensing the vocal cords, okay? Now let's see their nerve supply. The nerve supply, this is everything I mentioned here, okay? So I'm explaining from this slide everything that's in the coming slides, okay? If you want to go over them again, it's fine, but it's the same thing I just said. Now we're going to go to the nerve supply. The nerve supply for everything in the larynx or the whole larynx is إيش? Vagus nerve. But it's not, we can't just say vagus stuff. We have to say or be specific and mention which part of the vagus nerve or which division of the vagus nerve. So the vagus nerve يطلع لنا divisions, okay? أول branch or أول division يطلع لنا هو اللي هو إيش? Internal laryngeal nerve. The internal laryngeal nerve is the first division. Underneath it we have the external laryngeal nerve. And then it continues down and passes the larynx, يعني خلاص اتعدى larynx. بعدين لما وصل هنا عند trachea, it's like, oh, oopsies, I remember, I forgot to supply some other muscles. So it gives another branch known as the recurrent laryngeal nerve. Recurrent laryngeal nerves. This is the last branch. So now let's see which branch supplies which area, okay? First thing, let's go back to this side here. قلنا intrinsic muscles are divided into all the sections, right? Which the muscles that increase the size of the laryngeal inlet, the muscles that abduct and induct the vocal cords, and the muscles that increase the tension and relax the vocal cords. All of these muscles we just mentioned are supplied by the recurrent laryngeal nerve اللي هو this branch, the last branch اللي هو بعد ما تعدى larynx. It's like I forgot to supply other muscles. It goes back, it gives a branch known as the recurrent laryngeal nerve. This branch supplies all the intrinsic muscles except, صح قلت لكم في exception, I said there's an exception we need to remember, the cricothyroid. The cricothyroid is a special muscle. We treat it, it has a special treatment لأنه it's the only muscle that causes the high pitched sound. So بنعملها معاملة خاصة. So the supply for the cricothyroid muscle is external laryngeal nerve, which is the second branch, this one, okay? The external laryngeal supplies the cricothyroid. Any other intrinsic muscle is supplied by the recurrent laryngeal nerve, okay? Any other muscle is supplied by the recurrent laryngeal nerve, okay? Here it's the same thing. قلنا the nerve supply is divided into two supplies, motor or sensory. In motor, all the intrinsic muscles supplied by recurrent laryngeal nerves except for the cricothyroid, which is supplied by the external. أما sensory, the sensory are divided into above the vocal cords and below the vocal cords. So anything above the vocal cords is going to be supplied by the internal laryngeal nerve. The internal laryngeal nerve supplies anything above the vocal cords, anything below is supplied by برضو الrecurrent. So here everything is just, if we remember, everything is supplied by the recurrent except for the cricothyroid by the external laryngeal, and the things that are above the vocal cords or the structures that are above the vocal cords are supplied by the internal laryngeal. تمام? Here are the questions the doctor mentioned. You can go over them. But then we have the blood supply. The last part of this lecture is the blood supply. The blood supply عندنا arteries والveins, right? So they're the same thing. They have the same names. The arteries we have above the vocal cords, superior laryngeal artery. Below the vocal cords, inferior laryngeal artery. And same thing for the veins. Superior thyroid vein and inferior thyroid vein. Okay? The last thing we have here is, remember in the beginning of the lecture when we were talking about the cartilages and we mentioned that there are two structures that pierce the thyroid cartilage. إيش كانوا? They were the internal laryngeal nerve and the superior laryngeal artery. صح, we said there are two structures piercing the thyroid cartilage, an artery and a nerve. So it's the internal laryngeal nerve and the superior laryngeal artery. So here we can see them. Here this is the superior laryngeal artery. Okay? So this is just to remind us, these are the two things or the two structures piercing the thyroid cartilage. So here's the last question for the doctor. Which muscle opens the airway? قلناها here. This one. So it's going to be the posterior cricoarytenoid muscle. Okay? So by that we have concluded the lecture.